Hi, I'm Dr. Mike DiTola, and welcome to What Lies Beneath, a show that looks at what drives some of today's most passionate clinicians to create beautiful chairside restorations. Our show partner is Kuraray Noritake Dental, a company whose world-class adhesive and restorative products allow dentists to provide their patients world-class restorations. In this episode, we will be taking a closer look at the Katana Zirconia Block and its use in creating beautiful chairside restorations. Today's featured clinician is Dr. Kristine Aadland. Chris has a private practice in Vancouver, Washington, and is also a faculty member at Pathway. Chris, thank you for taking some time out of your busy schedule to be with us today. I know you're teaching today, so thank you for dedicating some time to us.
Hey, thanks for having me. Always a pleasure to work with you.
So I want to hear about your introduction to, I know you've been doing CAD/CAM dentistry since you got out of school, which is really interesting because to most of us who are older than you, it kind of was something that we got introduced to later and had to make a decision. It's really all you've ever known in dentistry. But tell me about your introduction to zirconia, because, you know, for a lot of dentists, especially who focus so much on aesthetics, zirconia in the beginning seemed like a material that they might not necessarily want to incorporate into what they did. Do you remember how you first got introduced to zirconia and your first experience with it?
Yeah, absolutely. So I started CAD/CAM back in 2006. And so back in the RedCam days, we really only had the feldspathic porcelains, lucite reinforced porcelains. And then when I built my own practice, the game changer for me was Emax, because that was the really strong porcelain that came out. And then, of course, being a materials geek, I was really excited when zirconia first became a chairside material and the ovens would allow us to do that in a single appointment. But as you alluded to, it was not the prettiest material on the planet. And being a CAD/CAM doctor for a while before that, I didn't actually feel a huge need for zirconia for myself. I felt pretty comfortable in my preps. And so I played with it and I tried it, and we would tell our patients it was white gold for second molars, but it was not pretty. And I tried everything to make it pretty, but then that would lengthen our time and appointments. And so we went to IDS and got to see that first launch of Katana. And we were so excited to get that chairside block and get it in our hands. And we, went to some events to check it out, and it felt a little too good to be true. And the minute we saw it and started playing with it, it was beautiful. And I was hooked from there.
You know, one of our other KOLs in a different episode actually showed a picture at IDS of of the Katana Zirconia being out. And his comment was, it was the first time I had seen like zirconia, not shade guides, but they were next to shade guides. They were milled crowns and they were anterior crowns. And he said, kind of like what you said, that it almost seemed too good to be true, that you were looking at these anterior crowns that had this nice, you know, dent in third, middle third, incisal third, and got very excited and couldn't wait to get back. So that's kind of what opened your eyes to the fact that there might be a day where you'd be able to want to use it in the posterior and might be able to use it in the anterior.
Yeah, and what's nice is zirconia is milled out so much larger and then with more fine burrs. And so you can get that detail all by itself with the mill. You don't have to do a lot of post contouring. And then because of that shrinkage factor, it's like 23 to 25%. It fits amazing and easy to cement if you want to cement it. That gradation is beautiful. And if I can just polish a crown instead of spending the time staining and glazing, then it's pretty awesome.
Okay, interesting. So that's something that's come up on pretty much every episode, and certainly it's a question that I know dentists ask all the time, is polishing versus staining and glazing. Staining and glazing, we've been doing in the lab industry for 100 years, and it was the way to make ceramic porcelain look good. But we know that ceramic glazes do cause wear of opposing teeth, and if we polish zirconia, that's not going to happen. Nate Lawson came on and talked a lot about that. We're looking at a picture now of one of your crowns. Tell me about this. Has this been polished or glazed? And what drives you to maybe glaze a crown versus polishing it? Or how do you see that kind of dichotomy?
So this is just a crown that was milled out, just a crown that I would use every day. In the posterior especially, we have a really busy practice. We're going at 100 miles an hour. And so for time savings and just the beauty of this crown with a polish, I would rather just polish most of the time. Can you stain and glaze it? Yes. And I will do that in aesthetic cases, or if I do use it in the anterior. But if I don't have to, then why take those extra steps? And it's kinder to the opposing teeth, as you alluded to. So yeah, it's fantastic. And you can see the margins. I mean, look at those margins.
I know. I mean, to me, that was one of the things that first blew me away watching zirconia be milled, is that as you said, it's going to shrink 23 to 25%. That seems like a recipe for disaster. Like, how is that ever going to fit? Cast gold doesn't do that, and it fits, and so that's great. And so it's like the math behind it is kind of amazing too. But when you start to see the feather edge margins and the super thin chamfers that can be milled and how precise it looks. And that's a good example, that picture of yours where you can just see it, just a razor sharp margin all the way around. Were you surprised by the fit of zirconia when you first started doing it compared to maybe glass ceramics or PFMs?
I was, because there's a long time where you'd have to really bump that margin thickness out and have to do some finish work afterwards with glass ceramics, because in the milling process, you'd get a lot of chipping. And so when I started using zirconia and seeing those fine edges, because in real teeth, especially if someone has recession and you have to kind of get that more knife edge, you can't get this beautiful big chamfer. This is more realistic. And we're cutting down a lot of old amalgams, and the restorations are a little mix of everything. And this material handles that very well.
Yeah, it's more realistic, and it's also more conservative at the same time. So you're not having to put deep margins on, cementum. Tell me about this next crown we're looking at here.
So this is just, I took a picture of a crown that I just did in everyday practice. This crown was done in an hour. It was a cracked tooth, and she came in and prepped it, milled, design. We did the super fast mill, polished it, and sat it down. And this is hard to compare to. Like, it blends in beautifully, and it's done quickly, and it's very strong. This is what we aspire for every crown.
Yeah, is that a crown behind it, the tooth distal to it, or is that a natural tooth?
It is. It's a crown behind it.
That's a crown as well. And that just looks so good. When you look at the natural tooth in front of it, that second bicuspid, okay, God made that one. So maybe it's like 2% more translucent than the crown, but what an amazing looking crown for a zirconia crown that is. If you told me that was a glass ceramic that you had to bond on that was much weaker, I might not be surprised, but for that to be a polished only zirconia, that's one of the better looking single unit posterior crowns I've seen. So well done. And I'm sure the patient was, I don't know if that replaced like a PFM, but when you see how clean that margin is, and again, just the gradation, that is a gorgeous crown. That's impressive. Tell me about this.
So this is just a bridge. And again, it's just a polish. It was a situation where it was a little too tight for an implant. And so we were replacing an old PFM bridge that you can see the PFM behind it, that the old bridge matched very well. So it was a metal surface and not a match with her natural teeth. And what's great is if you mill this on the MCXL, this mills in 18 minutes. And so again, I can do bridges in one appointment, which we've never been able to do before. Some of the other blocks, it's a little bit longer mill time. And so if I can seat this in one appointment, not have to turn a room over and save my patient time, I will do it. And look at those natural results. And if you look at the tooth behind it, she was really extremely happy.
18 minutes is amazing. That's blazing fast to be able to mill that restoration. And it's funny, I see patients with gold crowns in their mouth. And I'm always like, oh, wow, look, you have a gold crown in your mouth. That's so cool. I bet that's almost as old as I am. How old is it? And they're like, I don't know, 40 years old. And I say, do you like that crown? They're like, no, I hate it. I'm like, why? It's been the most amazing crown. It's lasted 40 years. They go, I don't like how it looks. And so here it's served them for 4 decades, and they hate it. It's not like they had it for a week and then it broke. So it's interesting to really see that having something that behaves kind of like a metal or kind of like a gold, but is tooth colored, really is important to patients, because most of the time I'm saying this to them, it's on first and second molars. So I doubt this patient loves that second molar back there.
Right. And that was the first thing after I sat the bridge. She's like, okay, when can I fix this one? And I said, well, we talked about it before. And she's like, but I didn't realize how pretty it was going to look and how easy and fast it was. So she'll come back.
Yeah, she definitely will. And obviously, if you can turn that around in a single visit, that's really impressive. And here's where I'm surprised, because I know how fastidious you are about aesthetics. You must have had some reservations going into using chairside zirconia for anterior restorations.
Yeah, I never thought I would. I kind of take pride in the fact that there's not a lot that I can't match with my ceramics. And this is a woman who came to me. She was referred because she wanted something same day. She'd had an implant fail twice on tooth number 11. And so when I looked at her radiographs, there's some mismatch of color there that you see that not a lot of people would pick up, but 6 looks very bright. 7 and 10 were ceramics. And I didn't know if they were HTs, MTs, LTs. They were EMAX for sure, but I had no idea I mean, they could have been pressed for all I knew. She didn't know. And then 8 and 9 were zirconia, and she really liked that bright feel. And so I decided zirconia would be great. She needed it in the same day in a single visit. She was driving from far away. So if I could mill that again in 18 minutes, I was matching that bridge from 10 to 12. And then 7 I did in zirconia. And I was shocked. I warned her, like, I'm going to do this. And then I don't know, but I think the results turned out really pretty. It looked really natural. She was excited. Again, this is a single visit. I think we did this in 3 hours, doing a 3-unit bridge and then a single crown. I did add a little characterization because on 8 and 9, she had those white marks, those kind of decal marks at the incisal edge. But it blended fantastic.
That's incredible. And we see so many patients who we probably couldn't use glass ceramic on anyway, because maybe it's a bridge from 7 to 10, or maybe there's somebody who it's a severe wear case and it's like, oh, I can't trust anything in here. I don't want to put a bilayered restoration in here. And so to have a monolithic zirconia option like the Katana Zirconia and to be able to get results like this in the same day is pretty amazing. You find yourself using it. So in a case like this, you'll do it, but on advanced wear cases and things like that, where people have chewed through other restorations, are you finding yourself using anterior zirconia there just because of the longevity?
Absolutely. And also there's trends in dentistry, and right now people like that bright Hollywood smile, and you can achieve it in zirconia. So yes, I'll use it. I'm not scared of it anymore. I think that's the point.
Right. Bright but aesthetic, like it can, because there were certain like old B1 restorations, if it was in a PFM, where it was just like bright fake, like kind of toilet bowl. So I understand and agree with patients who want bright, but still some sense of kind of a natural aesthetic look. So the name of the show is What Lies Beneath. So I want to find out what lies beneath this intense dental passion of yours, not only for the practice of dentistry and teaching dentistry, but I want to know your origin story. Do you know, or can you remember like a day or an event or what it was where you said, that's what I'm going to do. I'm going to become a dentist.
I do, absolutely. So I was destined to be an engineer. My whole family's in construction, and that's what I did. I ran heavy equipment forever, and I'd be out on job sites in the middle of nowhere, and I loved it. I loved working with my hands and making things. And you can look at, we worked a lot near bridges and heavy highway, that kind of stuff, and you feel very accomplished. And my dad was talking me out of it. The industry was changing. So he said, well, what do you like about it? And I was writing this checklist. And at the time, my roommate was a hygienist, and she was so passionate about dentistry. Like she was just crazy. And she's like, you need to meet the dentist I work for. And I am incredibly phobic as a patient, both in the dental world and medical world. And I thought there's no way I would ever become a doctor or a dentist. And like, I think it's insane how much you love teeth and flossing. So she said, just do me the favor, just come to the practice that I'm working at. And so I said, okay. So I went and met, they were in a group practice, and these guys were just cool. And they said, if you want to get into this, we will help you do whatever you need. Just make sure you pay it forward. I loved that they own their own business. I loved most of all that they took Fridays off and they were either skiing on the mountain or water skiing. And I was like, oh, you only have to work 4 days if you're a dentist. And so I really had no idea what the day-to-day was. I just saw their excitement for what they were doing, and the whole shebang, like their time off when they wanted and family time and their community sense. And so just that day I was like, hey, this is what I'm going to do. I'm going to be a dentist. And so I went for it. And I thought I was crazy the first 2 years. Like I called my dad every day and was like, I'm heading back to running equipment. And he said, no, just stick it out. And then when I started seeing patients, that's what did it.
And I love that. I mean, for our audience at home, we are actually recording this on a Friday. And as you can see, Chris is teaching today at the Pathway. So her dream of having Fridays off, she shot herself in the foot because she's so passionate about teaching it that this is what she chooses to do with her day off, with her day out of the office. And that's what everybody loves about you, Chris, is that passion, not only for doing it, but for teaching it as well, and for that enthusiasm. You're the second person we've interviewed on the show who has this amazing mentor story where a dentist said, you can come hang around with us for a little bit and watch what we do. Have you had that opportunity yet to have somebody kind of come to your office, or somebody who's not sure about it? Because if you haven't, it will certainly happen, one day. But has that happened yet where you've had the chance to influence somebody?
Yes, and it's so great. I try to invite as many people as I can into our office because, our office, we have some cool technology and it's always humming and going, but then we're also a little crazy. And so we're constantly doing, now the whole thing is TikToks, but funny spoof videos and I just want people to see like the life is so serious and everyone tells you, I don't want to go to the dentist. And so if you can have a little fun with it, then it makes the day better and our patients love it. And we have our dog running around all the time. So yes, I love having people around. I love pushing them into dentistry and telling them how great it is and spreading the good word of it.
And the amazing thing is you're as high tech as it could possibly be, and then you're also as low tech as you could possibly be with your therapy dog, your dog who's there and who can sense patients that are anxious, which is really interesting because you just said that you're very anxious as a patient. Is that when dentistry became demystified for you? Do you have an easier time now being a dental patient, or do you still not enjoy being worked on?
No, I hate it. I typically have to be sedated or I have to talk my friends into working on me if I need work because they only will work on me one time and then they will never do it again.
Right. You have to find a new friend to work on you.
Yeah. My dog will come and sit in the chair with me and I'll just sit back. I have screens so I can watch Netflix and ignore whatever's going on. And I just hold my breath. I'm terrible.
What about hygiene appointments? How do you do during hygiene appointments?
They can clean 3 teeth at one time and then I get up and then I'll come back. It's very sad.
This is amazing. This is amazing that this is what you have chosen to do, and you do it so well, and you do it with such empathy for your patients by having the dog there and taking breaks and taking time and doing whatever they need. But it probably comes from this place of you being on that other. You're probably treating patients the way you want to be treated yourself.
Yes. Yep. I think that's our secret. And I'm pretty sure if phone books still existed or ads were out there, they say all phobic patients, please come here because we definitely have a good following of it. But
well, that's great. You have a beautiful dog. You've got a gorgeous website, and you have a great practice. Chris, thank you so much for taking some time out of your busy schedule to be with us today.
Thank you so much for having me.
Well, that will wrap it up for this episode of What Lies Beneath. So on behalf of myself, Kuraray Noritake Dental, and Practice Passion, I want to thank you for your time and your continued commitment to quality dentistry.